Hi there, this is Dr. Evan Osar with Integrative Movement Institute. Welcome to this edition of Integrative Movement Insider. Hope you're having a great day and your week has started out well and you're out there serving your clients, which I know you are. Appreciate you being part of our community and joining me for this edition of Integrative Movement Insider Live. On our Instagram page, so you can follow us at IIHFE, so that's IIHFE on Instagram. We post regular exercises, do's, don'ts, do it this way, don't do it this way, and then more importantly, why you do what you do and how you should perform exercises. Because we base that on three things. Number one, functional anatomy. Because you should determine your client's needs based upon their history. However, what you do and how you perform exercise is really based upon those three things. Number one, anatomy. How does the anatomy actually work in optimal function as we understand it today? Number two, biomechanics. Do you understand how the joints should move versus how many of us have been taught to move? We'll talk about the hip here today in a moment. Number three, motor control. How the brain is receiving information and then putting out that output based upon the information, the experience, the exercises that you're actually having your client do. So let's talk about a very common exercise for the hips. You see it in the rehab world, you see it in pre and post rehabilitation, you see it as a common corrective exercise. It's oftentimes a warm-up exercise because it's so basic and we barely pay attention to the form of it. However, the bird dog exercise, which is actually, we're not doing bird dog today. I did that on my Instagram page. So you can, again, check it out. IIHFE. It's posted there. Today I actually posted about the glute bridge and why this pattern actually creates a lot of hip issues. It's a common pattern for our clients. Not many of them actually perform it well. So let's talk about it real quickly because, again, you're like, oh, Dr. Osar, I've seen this thousands of times. Sure, you've seen it thousands of times. And I love this quote. And I don't know who said it, so now it's my quote. You want to be extraordinary at the ordinary. And too frequently, we're giving our clients exercises and just having them go about it and not really paying attention to how they're doing it, and more importantly, what impact it's having on the body. Because your nervous system will always let you know what impact you're having. So let's take the glute bridge exercise. Let's test this theory for ourselves. Because again, I don't want you just to take my word for it. I want you to experience this in your body. So I want you to try this. Do something to create more hip mobility after this. So you can do this with me as you watch this. So let's check out our own hip mobility. So stand, put your feet together, put your hands on your hips. So what we're going to do is just check simple standing hip rotation. Just quick, easy scan of hip rotation. My hip rotation is actually pretty good right now. Pretty symmetrical side to side. Normally, I'd be tighter, more restricted on my left hip. However, I just did my corrective exercise, so it's quite symmetrical right now. Feels free, feels even. Now, let's go into our glute bridge exercise. So let me move you down here. I'm going to move you down to the floor. Hey, Eric Berrien. Hello, Mary Trella. How are you guys doing? Mary Trella helps us out, keeps us on pace. I should say keeps me on pace. Thank you for that. It's a full-time job, Mary Trella. Eric, how are you, my buddy? So here we go. Let's do traditional glute bridge, 10 reps of how most clients are doing. So most of our clients, again, let's stay with older adults. Most of our older adult clients, depending on their size, they may have wider glutes and hips, more mass back there, shorter tibias. I tend to have longer tibias, don't have much mass back here, so it's easier for me to get range of motion. But most of them, or I should say a lot of them, don't have range of motion. So what they do is they push up and they start to push that direction. Then our industry also teaches squeeze those glutes and drive that pelvis up like you're trying to squeeze something between your butt cheeks. So let's just do 10 of those. There's 8, there's 7, there's 6, there's 5, there's 4, 3, 2, 1. The other thing we didn't do is we didn't put a band around our knees like many people do and teach and bring the knees out away from midline of the body. So again, that was 10 repetitions. Now let's go determine for ourselves our impact of our exercise. So again, let's go back, feet back together. Let's see what impact that exercise, 10 reps, had upon my range of motion. Hip rotation. There's right rotation. Doesn't actually feel as good as it did before, and I can already tell left rotation is dramatically different. That was 10 repetitions, 1 set. That was no band around my knees. That was no excessive external rotation against resistance. That was 1 set, doing nothing else but doing the exercise the way I was taught in the industry, the way I see taught so frequently. So if you are not assessing, here's your take-home message for this video. Hopefully you've heard me say this before. If you are not assessing your client and the impact their exercises are having on them, you don't know what's happening to them. You're not understanding why they're getting tight. And I did this for years and years and years, and that's why early in my career, I didn't really get a lot of people better. I didn't really help a lot of my patients because I wasn't understanding. I was just doing exercises because I was taught that these glute exercises strengthen the glutes. And you can see, it didn't maybe strengthen my glutes, maybe, but it dramatically and instantly, not 3 sets from now or 10 sets from now, right now it decreased my range of motion. This is why this is so important. This is why we teach this as a fundamental process or part of the process, the Integrative Movement System process that we teach as part of our certification program. And why it's so important, because you have to know how exercise is impacting your clients. Just like you have to know how medication is impacting your clients, you as a specialist need to understand what exercise is doing to your client, right then and there. Now, we've jacked our clients up by doing it this way, so now we gotta unjack ourselves. Now, you could do a corrective exercise like a supported hip hinge or something like that. You could do some simple corrective exercise pattern. We're gonna use the glute bridge done the right way. So again, let's check range of motion again. Feet back together, just to show that this hasn't changed. Okay, there's my range of motion. I can go further if I have to do something. I have to roll on the outside of my foot. I have to side bend to get more range. Whereas before, I didn't have to. So now, let's go back and do glute bridge the way it should be done. Okay, so here we go. Now, remember I said, for a lot of your clients, especially your older clients, shorter clients, you have to elevate their feet. So you have to put their feet up on a step or chair. Now, this is even too short for a lot of your clients, but we'll just use it for this purpose. So again, when you set your client up, align the head and neck, align the cylinder, the thoraco-pelvic cylinder, the ribcage and pelvis. Keep the spine as neutral as possible. So now I'm going to lift through my feet. And instead of trying to push myself back or my pelvis up, I'm trying to move my weight that way. My knees should move that way. I should do a hip hinge to do this optimally. So it's lift up. The weight goes down that direction towards my feet. I feel an activation of my glutes and hamstrings. I do not overlift. Now I do a hip hinge to drop my pelvis back down. The first thing that should drop back down is my tailbone. I should not have my back touching the floor first. I should lift up, tailbone lifts, pelvis lifts, weight is down there. Then I do a hip hinge, drop my hips back down. That's why you need more range, because you need range to get into that hip hinge position. It's basically a lying down or supine version of a hip hinge pattern. So it's up. So we'll do the same number of reps, 10 reps. Then back down. Again, much, much harder than the earlier version. Let's go up again. Again, the cylinder, the ribcage stays down. The back is not extending. The weight is down there. Hamstring and glutes are on fire. That's 4 repetitions. Let's go 5. Keeping the weight down that direction. You should see my knees moving that direction. Coming back down to control. Go 2. Let's go 5 more. 5. Come back down. Controlling. 4. Let's go 3. 2. Make sure that those ribs stay down, connected to the pelvis. And 1. And relax. Much harder. Hamstrings, glutes burning, whereas before, I didn't barely feel them working at all. So now, let's go see what the impact of the exercise was compared to the other version. Hello, my friend Raul from India. Welcome everybody else that's just joining us. So now, let's go back. Let's recheck range of motion. So feet back together, hands upon the pelvis. Let's rotate to the right side. That feels freer, feels back to where it was. Left side is more important to me right now. That's much different. Now I have freer hip range of motion. I don't feel that pulling. Dramatic difference in range of motion doing the glute bridge the optimal way versus how our industry teaches it, which is over squeezing the glutes, over contracting the glutes, driving that femoral head too far forward in the acetabulum, over extending the back, and then using the hip, or I should say knee extensor dominant technique and moving the head back. That's the importance of understanding what should happen through the hip. For example, in this case, what the functional anatomy should be doing, what the glutes should be working, not overworking. The hamstrings should be engaged, not overextended. Over-engaged. And we should be moving through the hip, not driving the body back that direction or trying to drive the pelvis, the pubic bone, up towards the ceiling. It should be a nice controlled hip hinge, just as if you're teaching your client how to do a hip hinge standing up. It's just a supine version of it. So I hope that made sense. Hope you enjoyed that video and the importance of doing the ordinary. An ordinary glute bridge and making it extraordinary. Using your assessments to drive your decision making in how you teach exercise and understanding then what impact the exercise, whatever it is, corrective exercise or functional exercise progression has upon your client. And that's how you differentiate yourself from the rest of the noise in the industry and set yourself up as a specialist so that your current clients know that you're the best solution for them and your potential clients understand that you are a specialist that can help them with their posture, movement, the chronic tightness, discomfort, those things that inhibit them from doing the things they need to and want to do. If you're looking for more information just like this, we're teaching a 3-day online. It's 3 Fridays, so 1 to 5. So we made it Friday afternoons just to make it easy, convenient. That's when most fitness professionals are not seeing clients. Fridays in October. So the first 3 Fridays in October, 1 to 5, we're teaching these concepts. We're going to teach you the functional anatomy around the hip, the core, and the shoulder. We're going to teach you how to assess your client so that you know why you're assessing and what you're assessing for, how to assess, and then that will ultimately drive your corrective exercises. And then how to perform those corrective exercises like the glute bridge, like other exercises. For example, on Instagram, I just discussed bird dog yesterday and how the bird dog exercise creates a lot of hip issues. Again, go check it out, IIHFE, just so you can see what I'm referring to, the bird dog exercise. Just like the glute bridge does to decrease hip mobility, so can the bird dog when it's performed improperly. Again, super, super important concept, and this can make all the difference for your clients that have been struggling with chronic hip issues, or core or shoulder issues. So again, it's 3 Fridays. 21 hours in total. You're going to do some self-study. It's learn at your own pace. Obviously, we hope you join us live for the live sessions, 1 to 5, where we walk you through the actual program. However, there's also some self-study and some self-reflection where you do the work on yourself, because that's how you learn, that's how you master this information. So 3 Fridays, 21 hours, CEC's involved with that as well. 3 days, it's 100% online. It's going to be interactive, so we're going to be having you do things just like we had you do here, so that you experience what it feels like in your body. So you're going to learn the anatomy around the hip joint. You're going to learn the anatomy around the core. You're going to learn the anatomy around the shoulder. Why so many clients have these chronic issues. Why maybe some of you actually have chronic issues as well. Because again, this is important that you prolong your career so that you can be that leader that shows clients how to do it well in the meantime as well. Okay, assessments, corrective exercise, and we'll show you how to integrate this into the functional exercise programs. We're giving you our best information. Best way to, 3-day way to learn this information, small chunks, and apply this information, go out, use it, come back, learn another small chunk of information. Most importantly, like I said, do this because you want to be known as a specialist. Do this because you want to be able to differentiate yourself from the rest of the noise in our industry. People are just trying to give people good workouts and just get them sweaty. You need to be the solution. Your clients are looking for a solution. Be that solution. So we hope you join us. If you're looking for any information, or we should say more information, feel free to put below this video, next to the video, wherever you're watching this. Mary will put the link next to it. Put your questions in here. Happy to answer those as well. If you'd like to join us, let us know. We'd love to have you. It's going to be a great interactive session. Raul's going through our year-long certification program right now. He can tell you about how much information you will learn in just the first 3 days. He came through the Foundations program in the first 3 days. He's been part of most of our programs. He'll tell you how great this information is and how much you can use it, because we want to create information that you can use right now. Not 3 weeks from now, not 3 months from now, not 3 years from now. We want you to be able to apply this information to the programs that you're already using with success. So, Look forward to seeing you October 1, 8, and 15. 4 hours. However, total is 21 hours because you'll be doing some self-study on your own around anatomy, around doing some homework on yourself and your clients, so that way you can use this information and apply this information right away. Dr. Osar with Integrative Movement System. Thanks so much for joining me. Again, any questions, put them below this conversation right here, and I'll get back to them, and we'll reach out to Mary at helpdesk@fitnesseducationseminars.com. Should put the link below if you want to learn more information. I hope to see you in October. Make it a great day. Continue to be the light. Be out there, serve your clients, make this world a better place. Make it a great day.